Welcome to the City of Austin Open Enrollment video. Open enrollment begins October 12th and ends on November 15th, 2020. The 2021 benefits information can also be found online at austintexas.gov/benefits. This is your opportunity to make changes to your benefit elections. You can add or drop dependents and enroll in or change your benefits. You may also cancel any of your benefits. Changes made during open enrollment will become effective January 1st, 2021, and the first premiums are deducted from your paycheck on January 22nd, 2021. Your individual employee coverage information statement will be delivered to your home. The benefits guide will be available on the city's benefits page at austintexas.gov/benefits. If you were hired after September 2020, you will not receive a coverage information statement, and to make changes, you will need to contact the Employee Benefits Division, and we will set up a time to assist you with open enrollment. The coverage information statement shows your current 2020 benefits with the 2021 rates. It also includes the names of your dependents who are currently enrolled in benefits. If you find a mistake, such as an incorrect date of birth for a dependent, you can update the information through the open enrollment system or by calling the open enrollment phone number. If you want to make changes after reviewing the 2021 materials, there are two ways to participate in open enrollment: online or by telephone. The online enrollment system begins October 12th and ends at midnight November 15th. You will need your employee ID number, which is located on both your timesheet and your coverage information statement, and the first 5 numbers of your Social Security number to access the online enrollment system. The telephone enrollment phone number is available between 8 a.m. and 5 p.m. Monday through Friday from the beginning of open enrollment through November 6th. Call 512-493-1350. Operators are available in English and Spanish. When you complete the online or telephone process, you will receive a confirmation statement via email within 1 day or mailed to your home address within 2 business days. Carefully review your elections as well as your tobacco status. If you find a mistake in your confirmation statement, you must repeat the open enrollment process to make corrections. If you don't receive a confirmation statement, it is likely your changes were not accepted. Please access the online system or call 512-493-1350 to verify your changes or repeat the process. For 2021, the city continues to offer 3 medical plans. The first plan is the CDHP with a health savings account. This is a high-deductible health plan with lower premiums than a traditional health plan. The PPO is a traditional health plan with copays, coinsurance, and deductibles. And the HMO is a traditional health plan that requires a primary care physician for services and referrals to be covered, and there is no out-of-network coverage except for emergencies. Each of these plans will be discussed in further detail. Let's start with the CDHP with HSA. This plan encourages wise choices in the use of healthcare services and has lower premiums than the HMO and PPO plans. With the CDHP with HSA, you have access to in-network and out-of-network services. You can use any doctor, clinic, hospital, or healthcare facility, but you save money when you use in-network providers and facilities. The CDHP has a health savings account as part of this plan. The HSA is a bank account in your name that you can use to pay for eligible medical, prescription, dental, and vision expenses. The city contributes money to your health savings account on an annual basis. The city will contribute the funds as follows for 2021. For full-time employees, $500 for employee-only coverage and $1,000 for employee independence coverage. For part-time employees working 20 to 29 hours, $250 for employee-only coverage and $500 for employee independence coverage. You can also contribute money from your paycheck to your HSA each pay period in addition to the city's contribution amount. This will lower your taxable income and the amount that you pay for taxes each pay period. You can change the amount you contribute from your paycheck throughout the year. With employee-only coverage, you can contribute up to $129 per pay period, and with employee independent coverage, up to $258 per pay period. The HSA funds you and the city contribute roll over year to year, therefore you will not lose any money that's not used. So when you retire or leave the city, you keep all the money in your HSA account. You cannot enroll in a healthcare FSA if you have the CDHP with HSA plan. You will receive a debit card from HSA Bank to access the pre-tax funds in your account. When it comes to paying for services, here are some of the basic costs. Preventive care such as routine physicals, well checkups, mammograms, and colonoscopies are covered 100% in-network. The annual deductible for the CDHP for employee-only coverage is $1,500, and for employee independents, it is $3,000. After you reach the deductible, the plan pays 80% when a Tier 1 provider is utilized, or 70% with an in-network provider for eligible covered services and facilities. A Tier 1 provider is designated as providing higher quality of care and cost efficiency. To find a Tier 1 provider, visit bcbstx.com/COA and utilize the Find a Doctor tool. The annual out-of-pocket maximum is $5,000 for employee-only coverage and $6,850 for employee independence coverage. Here is an example of how paying for services works with the CDHP with HSA plan. Jennifer is enrolled in the CDHP with HSA Employee Independence Coverage. By enrolling in the CDHP with HSA instead of the HMO, Jennifer saved $2,406 in premiums. Jennifer's son is sick, and she takes him to the doctor. The cost of the visit after the contracted discount is $100, and she uses her health savings account debit card to pay for the office visit. Her out-of-pocket cost is $0 because she uses $100 of the $1,000 the city contributed to her HSA. This was their only medical expense, and her HSA balance of $900 will roll over to the next year. When you reach your out-of-pocket limit, which includes the deductible and coinsurance, the plan pays 100% of covered services for the remainder of the calendar year. Now let's talk about the PPO plan. With the PPO plan, you have access to in-network and out-of-network services. You can use any doctor, clinic, hospital, or healthcare facility, but you save money when you use Tier 1 or in-network providers and facilities. You have some coverage if you need to go out-of-network. Choose what's best for you. Just remember that out-of-network providers will likely charge you more. Out-of-network providers can even bill you for the amounts over what your plan will cover. When it comes to paying for services, here are some of the basic costs. Preventive care, such as routine physicals, well checkups, mammograms, and colonoscopies are covered 100% in the network. Office visits to your primary care physician will be $10 if a Tier 1 provider is utilized, or $25 for a network provider. Office visits to a specialist will be $25 if a Tier 1 provider is utilized, or $45 for a network provider. Emergency room services are covered at a $200 copay. For major diagnostic services, including MRI, CT, and PET scans, there is a $100 copay. Minor lab, X-ray, and preventive services are covered at 100% with no copay. The annual deductible for the PPO plan will be $500 for individuals. The deductible for this plan only applies to outpatient surgery, hospital admission, ambulance services, or durable medical equipment. After you reach the deductible, for eligible covered services and facilities, the plan pays 80% when a Tier 1 provider is utilized, or 70% with an in-network provider. For hospital admission, if you use an in-network provider instead of a Tier 1 provider, a $250 copay will apply in addition to the deductible and coinsurance. The individual out-of-pocket maximum is $4,000. The out-of-pocket maximum includes deductible, coinsurance, and copays. The family out-of-pocket maximum is $12,700. Next, let's discuss the HMO plan. The HMO plan will require you to select a primary care physician for yourself and each of your covered dependents. You will need a referral from your selected primary care physician to access other services, such as specialists, except for urgent or emergency care. If you have not selected a PCP, one will be designated for you after 30 days. To change your PCP throughout the year, call the number on the back of your medical card. The change will go into effect the first day of the following month. The HMO plan has a service area requirement. You must receive services in the following counties: Bastrop, Blanco, Burnett, Caldwell, Hayes, Travis, and Williamson. When it comes to paying for services, here are some of the basic costs. Preventive care such as routine physicals, well checkups, mammograms, and colonoscopies are covered 100% in the network. Office visits to your primary care physician will be $10 if a Tier 1 provider is utilized or $25 for a network provider. Office visits to a specialist will be $35 if a Tier 1 provider is utilized or $55 for a network provider. For emergency room services, there is a $250 copay. For major diagnostic services, including MRI, CT, and PET scans, there is a $150 copay. Minor lab, X-ray, and preventive services are covered at 100% with no copay. Outpatient surgery will be $750 if a Tier 1 provider is utilized, or $1,000 for a network provider. Inpatient hospitalization will be $1,500 if a Tier 1 provider is utilized, or $2,500 for a network provider. Services are available at in-network providers only, except for emergency situations. There is no deductible for individuals or families on this plan. Quest and CPL are the designated in-network labs for the HMO plan. You should always verify that the lab you are utilizing is in-network prior to receiving services. For employee-only coverage, the out-of-pocket maximum is $4,500. For employee-independent coverage, the maximum is $8,000. The out-of-pocket maximum includes copays and coinsurance. Each of the medical plans offered includes prescription drug coverage. The prescription drug list is the list of prescriptions that are covered by the plan and organized by cost tiers. To know if a prescription is covered, you can check the prescription drug list. You can find these lists at austintexas.gov/benefits. Choosing medications in the lower tiers may save you money. Tier 1 medications typically include generic drugs. Tier 2 medications are preferred brand name drugs, and Tier 3 medications are non-preferred brand name drugs. Affordable Care Act mandated prescriptions for preventive medications are covered at 100% under all medical plans. For the CDHP with HSA, there is also a preventive drug list. There is no deductible and the plan pays 80%. There is also a basic drug list. The plan pays 80% after the deductible is met. For the PPO, there is a $10 copay for Tier 1 medications. Tier 2 medications will have a $30 copay, or 20% of the cost, with a $60 maximum. Tier 3 medications will have a $50 copay, or 20% of the cost, with a $100 maximum. A $50 deductible applies to Tier 2 and Tier 3 prescription drugs per covered person per year. You can continue to get a 90-day supply through mail order for only 2 copays. For the HMO, there is a $10 copay for Tier 1 medications. Tier 2 medications will have a $35 copay, or 20% of the cost, with a $70 maximum. Tier 3 medications will have a $55 copay, or 20% of the cost, with a $110 maximum. A $50 deductible applies to Tier 2 and Tier 3 prescription drugs per covered person per year. You can continue to get a 90-day supply through mail order. However, 3 copays still apply. If you or your spouse or domestic partner are enrolled in a city-sponsored medical plan and use tobacco products, a $12.50 premium will be charged per person per pay period. Let's talk about how you can avoid paying the tobacco premium. If you completed the Tobacco Cessation 101 class between January 1st, 2020 and September 30th, 2020, and no longer use tobacco products, you must participate in open enrollment and select the non-tobacco status option to avoid paying the tobacco premium beginning in January 2021. Attending the 2-part Tobacco Cessation 101 class from January 1st, 2020 through September 30th, 2020 only waives the premium for 2020. Attending the classes scheduled October 1st through December 23rd, 2020 will waive the premium for 2020 and for 2021. The Tobacco Cessation class schedule is available at austintexas.gov/benefits. The city offers 2 flexible spending accounts that allow you to set aside money before taxes. This lowers your taxable income and can result in lower tax deductions from your pay. The money you set aside should be calculated based on 24 pay periods. The Healthcare FSA allows you to set aside the amount you anticipate spending on allowed medical, pharmacy, dental, and vision expenses for the year. You can set aside from $5 to $114 per pay period. You will receive the full amount upfront for the entire year on January 1st. A debit card will be provided to you to pay for eligible expenses at the time of service. With the Dependent Care FSA, you set aside pre-tax money for eligible dependent care expenses. You can receive reimbursement for daycare expenses for children under age 13 and/or disabled dependents of any age spending at least 8 hours a day in your home. You can set aside $5 to $208 per pay period. To receive reimbursement, use the bank card provided or complete a claim form. You will use the same debit card for both accounts. Some restrictions to be aware of with flexible spending accounts are: if you chose to enroll in the Consumer-Driven Health Plan or CDHP with HSA, you cannot participate in the Healthcare FSA as you have a Health Savings Account or HSA. Flexible spending accounts are use it or lose it, and money not claimed by the deadline is lost. Remember that once you enroll in a flexible spending account, you are committed for the full year unless you have a qualifying life event. Now let's go over some additional benefits. Please refer to your Employee Benefits Guide to get more details about any of these benefits. In January, the city's dental plan will now be referred to as the Blue Care Dental Plan administered by Blue Cross Blue Shield. Employees and dependents will be able to seek services using in-network and out-of-network dentists. The example below shows how a claim would be paid in-network versus out-of-network. Employees using an in-network dentist will see a greater savings, which means the $2,000 calendar year maximum will go further towards dental services. Out-of-network services will continue to be paid up to the table of allowance. For more information, call Blue Care Dental at 888-907-7880, and to search for an in-network dentist, go to bcbstx.com/COA. Davis Vision is the City of Austin's vision provider, offering you and your dependents coverage for annual exams, glasses, or contacts. Routine eye exams can ensure that you have clear vision and can detect a variety of medical conditions such as diabetes and glaucoma. Davis Vision offers a comprehensive dilated eye examination each calendar year for a $10 copay. They have a large network of providers as well as retail optical chain stores such as VisionWorks, TSO, Walmart, and Sam's Club. The plan covers costs for either a pair of eyeglasses or contact lenses once per calendar year. Short-term disability and long-term disability are benefits to supplement your pay if you were not able to work due to an injury, illness, or maternity. Short-term disability is offered at no cost to employees who work 20 or more hours per week and pays 70% of your base weekly salary while you are not able to work due to an off-the-job injury or illness. You are automatically enrolled in this benefit. So why would you want to elect long-term disability in addition to short-term disability? In case your injury or illness extends past 90 days, or if your injury or illness is permanent. Long-term disability will cover 60% of your base monthly pay, and you can continue to receive disability income even after ending employment with the city if you continue to be disabled. Long-term disability covers on and off-the-job injuries or illnesses. To calculate your cost for long-term disability, click the links at austintexas.gov/benefits. Basic life insurance is offered at no cost to full-time employees, and you are automatically enrolled. Your beneficiaries will receive one time your base annual salary. Supplemental and dependent life are available as optional benefits and are fully paid by the employee. You can purchase life insurance for your spouse, domestic partner, and eligible children. You can update your beneficiaries at any time during the year. To update your beneficiary, you can use the HR portal if you have access, or complete a beneficiary designation form at your departmental HR. The ARAG Ultimate Advisor Legal Plan offers you and your dependents legal protection coverage. ARAG offers a comprehensive array of legal services, many of which are paid at 100% when you use an in-network attorney. You can work directly with an attorney by phone or office visit to address legal or financial matters. Legal tools and documents are also available online. Keep in mind, the plan is not a license to sue, nor can it be used to take legal action against the City of Austin for any reason. During open enrollment, you can enroll in the city's 457B Deferred Compensation Retirement Plan using the online open enrollment system. So what is a 457B Deferred Compensation Retirement Plan? A governmental, or 457B, deferred compensation plan is a voluntary retirement savings plan that allows eligible employees to supplement any existing retirement or pension benefits by saving and investing through voluntary salary deferrals. The city's plan is offered through Empower Retirement. If you currently do not participate in the deferred compensation plan, you have the option to enroll in the plan using the open enrollment system. Below are a few details if you choose to enroll. Your per-period contribution will be deducted pre-tax and will default to 2% of your salary. The investment option will default to the age-appropriate target date fund. You will be contacted by an Empower Retirement representative in December to confirm your enrollment, assist in making any changes to the contribution amount, the pre-tax election, or the investment option, and explain how your funds are allocated and managed. Your first payroll deduction will begin January 8, 2021. Please note that current deferred compensation plan participants are not able to change their contributions through the open enrollment system. If you wish to change your contribution amount, go to dcaustin.com or contact Empower Retirement at either 866-613-6189 or 512-651-2287. Full-time regular city employees may be eligible for financial assistance of $100 weekly for children enrolled in daycare up to kindergarten eligible, $100 weekly for disabled dependents up to age 26 enrolled in daycare, and $30 weekly for children ages 4 through 12 enrolled in after-school care. Eligibility is based on family size and gross income. Applications for the program are accepted at any time throughout the year, and you must recertify for the program November and December for the upcoming calendar year. The Youth Camp Scholarship Program is available to all full-time city employees with children ages 4 through 12, regardless of household size or family income. The program provides scholarships of up to $50 a week at participating Parks and Recreation Department recreation centers during spring and summer breaks. Employees must apply by the established deadlines each year in order to be placed on the PARD eligibility list. Applications are available online at austintexas.gov/benefits. All city employees can receive free assistance researching and locating potential child care providers by visiting dfps.state.tx.us/childcare. Other programs and benefits included at no cost to employees are the Employee Assistance Program, which offers short-term face-to-face or telephone counseling to you and any member living in your household. The Commuter Programs, which offer free bus and rail passes as well as a subsidy for vanpool participation. The Paid Parental Leave Program, which offers FMLA qualified employees up to 240 hours of paid leave for the birth and care of a child, placement of a child for adoption, or foster care. The Leave Bank Program, which offers employees who become members during open enrollment the ability to access up to 240 hours of paid leave for a qualifying FMLA event throughout the year. And the Employee Discount Page, Perks Connect, which offers employees and their dependents discounts on a variety of products and services. For more information about any of these programs, please refer to your Employee Benefits Guide. Almost half of all City of Austin healthcare claims are due to preventable health conditions. The city's wellness program, Healthy Connections, provides resources and incentives to help you meet your health and wellness goals. Employees engaged in wellness activities have lower healthcare claims costs, fewer ER visits, and higher rates of preventive screenings. The wellness program can save you and the city money by lowering overall medical claims, which means lower monthly premiums for you and the city. Becoming healthier is a lifestyle change and takes time, planning, and support. Our programs are designed to help. The first step to a healthier you is getting your health numbers and completing the BCBS online health assessment. Employees who complete the online Well on Target Health Assessment questionnaire at bcbstx.com/COA can earn 8 hours of wellness administrative leave once per calendar year. The next step is to make sure you are up to date on your preventive exams. The city medical plans pay for routine physicals at 100% with no copay, and you can earn $75 in healthy rewards for certain preventive services. Healthy Connections encourages you to take the following actions for optimal health. Eat 5 servings of fruits and vegetables a day. Exercise at least 150 minutes a week. Learn stress management techniques. Use your self-care resources available through Blue Cross Blue Shield and maintain a healthy weight. Benefits of good health include feeling better, living longer, and being sick less often. Healthy Connections offers a variety of programs, including group fitness classes, fitness and nutrition challenges such as Million Mile Month and Sugar Awareness Challenge, health awareness campaigns, tobacco cessation classes, PE classes, and flu shots. Visit our comprehensive wellness website for information about upcoming events. You can also ask your department's wellness champion or call 512-974-3284 and ask to speak with a wellness consultant. We hope to see you at our next Healthy Connections event. The City of Austin Employees Retirement System is preparing to launch its new online information portal for members called Member Direct. The new online portal will allow active members to securely access their retirement account and information from anywhere, anytime, and on any device. Through Member Direct, active COAERS members will instantly know when they're eligible for retirement, obtain retirement benefits estimates, see options for survivor benefits, and view how deductions and insurance will affect retirement take-home pay. Active members can also see beneficiaries, update contact information, securely communicate with COAERS staff, obtain forms, and receive important notifications electronically. Starting this fall, COAERS members will be able to register for a Member Direct account on the COAERS website. Please email news@coaers.org to sign up for Member Direct launch updates to receive details about how to register and important COAERS announcements. For information about COAERS, visit www.coaers.org. Thank you for taking the time to review this year's open enrollment video. We hope you have enjoyed it and that the information has been helpful to you. Remember that telephone enrollment ends November 6th and online open enrollment ends November 15th. If you have any questions on any of the benefits that were discussed, please contact the Employee Benefits Division at 512-974-3284. We are available to assist you Monday through Friday from 7:30 a.m. to 5 p.m.